Yes, sir, we are live now.
Yeah. So, a very good evening to all eminent doctors, and thank you so much for joining for today's webinar. And this is an initiative of very large, so its innovations are for the society and humankind. And today's webinar topic is dosage reduction strategy in rabies management, role of novel vaccine. So, dear doctors, first of all, we have launched world first three-dose anti-rabies vaccine with more than 1 year ago. The name has Travis has successfully completed 1 year of launch with more than 40K animal bites vaccinated, and it is 100% compliance was recorded, and no case of adverse effect was registered. So, as per today's topic, with this, it is my honor to introduce you to our speaker of today webinar, Dr. Pankaj Verma, and he is practicing as a general physician from last 25 years, and he is running his clinic now from last 12 years successfully and giving his service to the for to their patients. So now I would like to request Dr. Pankaj to initiate the talk, and later on we will have the question and answer session. So Dr. Saab, over to you.
Hi, doctors. I'm Dr. Pankaj Verma, working as a general physician here at Lifeline Clinic Rishikesh for last 12 years. Uh, Regarding this vaccination, this means Travis vaccination, I have been using it for last when it has come in the market. So that's the same time when it has come to the market because few reasons regarding this thing. One is the patient compliance for the low doses. You all doctors know that one that there were 5 vaccinations in the past. Nowadays they are also running on. In fact, I'm not saying that. So the dosage means that five. In spite of taking five injections, you have to take 3 injections. The second benefit is not to do the reconstitution. You have to in the 5 dose regime you have to mix that powder form in water and then you have to inject it in. So there is a little bit of loss of the medicine, or that medicine is not that much of caliber, that vaccination is not that much of caliber. So this is also not to reconstitute the medication. As well as the third one is the Zydus Cadila company, the most trustable company, the top 5 companies in India. It's been a privilege for me for getting that, speaking on that vaccination for that thing. So uh, basically, what about the vaccine is it's a G protein vaccine, and in Indian scenario, it is round about. It's, uh, it's a bad luck to say that every 9 months, every 9 minutes, one patient is dying due to rabies in India. It's wrong. So regarding this thing, what all we can't control the stray dogs. We can't control the stray animals regarding this on our medical grounds. Noted in this highest in India. It's around about 20,000 human deaths every year from rabies. It is accounting for around about 60% or the all over deaths in Asia, and 35% globally. So, as I already explained, that there are one death from the rabies every 9 minutes, especially in India. Okay, the current management for this wound, like dog bite, cat bite, or camel bite, and all these things. First, we have to do the first aid. The local, yeah. What about this passive inhalation? Active inhalation, RIG. Shall I start from first or we start from? Should I start?
Yes, sir.
Okay. So, dear doctors, regarding the rabies, the introduction about this is globally 59,000 of human deaths are noted annually, highest in India, around about in 20,000 in India, accounting for 60% in Asia and 35% globally. 91% deaths in India occurred in only the rural areas. Every 9 minutes, a person dies from rabies in India. So the management for this dog bite or the animal bite or any cat bite and all these things, uh, local wound treatments, so like the washing of the wound with the plain soap water if carbolic acid is not available. If carbolic acid is available, that is the first and in choice of that one. The drug of choice for washing the wounds is carbolic acid. Uh, in the past or in the present also, we are taking a 5 dose regime of that intramuscular injections of rabies, and we have to reconstitute it, and then after we have to give it. But in this Travis vaccination, there are only 3 shots, 0, 3, and 7 days. With that, no reconstitution is one. Means there is no need of reconstituting the injection. So it's a great benefit for the patient also. So now the current rabies vaccines are cell cultured vaccines, which are not that in means that are not up to the mark right now. There are some demerits of that. Inconsistency in potency. Second was is stability. Second one is short supply or the availability, and the fourth one is adverse events. Especially in the inactivated vaccine, they are inactivated vaccines for last 15 years old. We are working on the 15 years old technology. So this is basically a big non-compliance of this one. Means not affecting the patient, not benefiting the patient as much the new one or the Travis is. So what about the compliance in the anti-rabies vaccine? The compliant, the patient who has received the full course of anti-rabies vaccine, that the full dose, full at the day, proper time and everything that has been written or that has been given instructed by the doctor, one has completed the full course of anti-rabies vaccine. Second one is a delayed compliant who completed the dose of anti-rabies vaccine within 60 days, but that person has deviated from the instructed or scheduled regime. Means if he has to take on that day, he has not taken on that day, he has taken after the 7 days, 10 days of that instructed day. The third one is dropout or non-compliant. who had taken at least one dose, only one dose of ARV, means anti-rabies vaccine, after the animal bite, but not completed the other, uh, in case of rabies, 2 vaccines, and in case of other vaccines, the 4 vaccines. Okay. Compliance to post-exposure prophylaxis among animal bite study, a hospital-based epidemiological study. Okay. At Safdarjung Hospital, New Delhi, the number of patients of animal bites were 360. A pre-designed, pre-tested structured questionnaire was administered at the inventory in 53%. So there are 360 patients who have been under the research work at Safdarjung Hospital, New Delhi. The 53% of them were non-compliant to the full course of ARV. It's a big thing. At Municipal Corporation Hospitals, Bangalore, there were 215 animal bite patients. 5 doses were given. Also, measures constraint for compliance to complete course. The compliance rate for intramuscular vaccination was only 60%. So that is also a big disaster. Constraints for compliance to complete. So there are few reasons regarding this thing. The patient is not taking the proper regime for this anti-rabies vaccines. The foremost and the first most cause is 47% of patients are not going for their instructed regime just because of their loss of money or loss of wages. Second one is 18%, that is they have forgotten that particular instructed date. Then the third one is the 13%, the cost of the injections or cost of the ARV. And the fourth and fifth lies on the 11% each. One is distance from the hospital, and the second is in uh, if it is in school going children, the timing of the school. So going for the past for this rabies vaccination, in 1885 there were up to 31 injections. They were given in live attenuated vaccine, the spinal cord. In 1911, that was inactivated vaccination. They were given 14 injections, zero point 0.5 ml daily. And nowadays, what is going on? Round about from 1976, it is 5 injection. That is inactivated vaccine or cell culture vaccine. That are 5 injections given in this deltoid area. Non-compliance led to evolution in treatment regime. Means from 31 doses, we have come to 5 doses. Now we have come to 3 doses. With this, so this is a novel 3-dose recombinant rabies G protein vaccine. Protein vaccine prepared by VLP. VLP means virus-like particles. In this virus-like particles, they produce a picture like that of virus, or they work like that, or but they are not carrying the genome of that virus. So it will produce the enough this antigenicity in the body, but it will not produce any genome related harmful effects of the virus. So it will, it by the name clears that one, virus like particle. Virus like particles means it will work as an antigen as a in the body, but it will not harm like the genome of the virus inside our body. Ready to use, no reconstitution required. That is the 3-dose regime. It means 2 doses are less. So VLP platform technology is the method. So the study conclusion is the first novel 3 dose was in non-inferior to reference vaccine, less adverse effects as compared to the reference vaccine, and the third one is only 3 dose means 0, 3, and 7. The 7 days found to be safe and immunogenic was comparable to as compared to 5 doses of WHO pre-qualified vaccine. Thanks, doctor. Thank you very much.
Uh, Thank you so much, doctor, for we have a wonderful session. And now, last but not least, I would like to tell you that our Thravis vaccine have two prestigious our pharma awards, that Golden Globe Tiger Award and ET India Pharma Award. So if anyone have any questions, so they can drop in the chat box. So Dr. Pankaj will be answer that question. So with this, now we end this session. And thank you so much for joining our webinar. Thank you so much. Varuman, should we end this meeting? Hello.
हेलो रवि सर वेबिनार कंप्लीट हो गया हेलो
Yes, ma'am. Can I end now then?
रवि सर कैन वी